Good afternoon, everyone. Thanks for being here. Hopefully everybody enjoyed the weekend. 0 deaths over the last 24 hours. Another good trend that we've been seeing. I think it was our most successful week over the last 7 days when you look at loss of life. So certainly good news there. Looking at testing, received back about 652 tests. We expect that number to start increasing again, a little bit of a lag going into the holiday weekend. Testing picked up a little bit over the weekend, and we'll do robust testing. That leads to artificially high at times infection rates if you're only receiving back a lower amount of tests than what you normally perform on an average. So we've seen that over the last few days. We expect that to correct itself. Our mandate is a region 775 tests. Over the last 4 days, July 2nd through the 5th, our region's average has been about 1,500 tests, a little bit over, so about double. Again, we probably will see a pickup there. Universal testing will continue this week at Syracuse Community Health Center, 9 to 5 on weekdays. Certainly testing is available at your physician's offices as well as urgent care sites as well. We're going to come up with our strategy for the next 7 days related to mobile testing sites, looking at data to help see if there's anything that will help us drive our decision making. I think hopefully we'll have that out in the near future here. Hospitalizations, 36. That's up 8 from yesterday. You think about it, right now we're talking about a virus that impacts how we breathe. Over the last week, we've had 90-plus degree weather, humid weather. We'll continue to see that. So the hospital numbers going up a little bit. We spoke to different reps from the hospitals today, and we'll continue to communicate with them on what they're seeing so we can communicate with the public overall. But certainly that analysis that I just gave you was an analysis that was shared with me from some of the hospitals, saying that this isn't something that is really too concerning at this point. On the good news, 4 folks now in the ICU. So 2 people recovered from the ICU since yesterday. And we have 2 people that are waiting a negative test to get back to their residence, being a nursing home. So that's important news because these are folks that have essentially been in a hospital for an extended period of time, no longer really need hospital care. Now that number is down to 2. At one point that was in the 30s and maybe even the 40s. And so these folks are ready to get back home. And so happy about that, happy about the ICU going in the right direction. Hopefully we'll see the hospital number drop back to the range that it has been in. It's really been in between that 24 to 28 range for an extended period of time. I think we're looking at probably a moment in time situation with the very hot weather, but we'll know soon. Looking at who's in the hospital, 19 Caucasian, 6 African American, 2 of another race, and 9 folks who have yet to share their demographic information with us. Looking at our positives, 2,844 positive cases since March 16th, up 21 since yesterday. 2 are household contacts of previously confirmed cases. 2 are from new cases affiliated with senior living facilities. That is 1 resident and 1 staff member. And so we now have, looking at 15 community spread, as we have 2 that we're still contact tracing. So community spread number a little bit higher. We're seeing certainly our younger demographics having more infections when you look at the percentages now of what our new cases look like. Our younger people, that's not really surprising in one sense. If you're going to have folks being impacted, you'd rather have folks younger impacted than folks in their 80s and 90s based off how the virus attacks the respiratory system. But certainly we think we got work to do with folks reminding them of how deadly the virus is and how really lethal it is. And it may not impact you one way if you're younger, but certainly your parents, your aunts, your uncles, grandparents, neighbors, it could have a really, really serious impact on them. So looking at active cases, presently monitoring 344 active cases, down 54 since yesterday. We had 75 recoveries since yesterday. So if you look at our chart here, again, flat going up. The green curve is recoveries, so that's good. Red is our cases. Our yellow flattened going down. For us to continue to have sustainable progress, we need to make sure that our infection numbers on a daily basis continue to stabilize. And so that's something that we really need to focus in on. Let's put things in context from where we have come. The week leading into phase one, when we first started to reopen our economy, our average cases per day was at 41. So going into restart, we're at 41 cases per day. The 7-day average from June 29th to July 5th was 18 cases per day at the second week of phase 4. So over the restart process, we have gotten better, and our data has improved significantly. Our hospital numbers have improved, and now we're seeing the fact that our loss of life has improved as well. So we're making significant strides and have done this, but we can't get too comfortable living with this virus. And that's my concern for the day, is our young people getting too comfortable in social settings, being in gatherings potentially that are legal, under 50, but maybe not wearing a mask and using smart physical distancing. So please, we need to be cognizant. We need to continue to keep this trend moving forward and improving so that we get all these businesses open and we get these liberties that we've had limited to us from going to a mall or going to a gym or going to see a movie. For us to get these back, there's more risk with these businesses. For us to get these liberties back, we need our data to continue to stabilize and to continue to get better. And so we need to be smart. Looking at the cases, the history of them, 1,672 have been female, 1,170 male. Looking at the demographics, under 19, 177, up 4. In their 20s, 503, up 3. 30s, 384, up 2. 40s, 342, up 2. 50s, 438, up 3. 60s, 352, up 1. 70s, 268, up 4. 80s, 235, up 2. 90s, 145, that's the same as yesterday. Reminders, we need to wear masks. I can't tell you how many complaints we've had over the last really week with mask wearing. Please, please, please take this seriously. It works. I was at the grocery store myself, saw a couple younger people, almost looked like they wanted a confrontation because they weren't really buying anything. They were walking around wearing masks. That's just not a smart thing to do or a kind thing to do to folks who are shopping. It makes your neighbors more comfortable when you're wearing one. It helps you, keeps you safer. The science on this is pretty conclusive. So please do this. In businesses, especially in big box retail, a lot of these complaints come from your businesses. We've notified many of you about this, and we're going to start enforcing this with fines. So the legal channels and the notifications have happened. We need you to make sure people coming into your stores are wearing a mask. That's good business, and it's the right thing to do during this pandemic. Certainly staying at home when you're sick, not just when you go to work, now when you're going to a social gathering. It's really critical that you do this. Take your temperature. If you have a fever, stay at home and go get a COVID test. The right thing to do for your own health, your own career, and your friends and family. Please do this. Phase 4 does not mean the health risk is gone. It means we've learned how to live with the virus. We've made strides with the virus, but we need to continue to make these strides. No room for unforced errors in this process. And certainly at some point, this will change when we have vaccines and antiviral treatments, but we're not there yet. And we got to get folks reopened. We got to keep our economy open so we can provide critical services and make critical investments in other areas. Certainly saw the news of the State Fair being closed today, not a surprise. Certainly disappointed, but support the decision. Another reminder that this is another economic stimulus for our region that we bank on every year that won't be here. So certainly we'll see an economic impact for businesses in the local area as well as government generating sales tax. So saying all that, I'll take questions.
Fair, another body blow to our economy. The obvious question is, what next? How do we gain that money lost or find a way to supplement that money lost from all that comes from the State Fair?
Yeah, I think the reality is that we're not going to make it back this year, and that there's maybe some smaller things that aren't as telling, but if we can get some of these smaller types of events going again, whether it's just your weddings, your typical banquets, your smaller things that you don't think a lot about being economic drivers, but it can help you get from negative 20% in sales tax growth to maybe negative 15 or negative 12 if you can get these things going. But the reality is this year we're going to have a massive loss on sales tax, and the businesses that usually make their living off of these types of events, these hospitality industry, are going to have the worst year in their history. So the federal government has stepped up with PPP loans for some of these businesses. Probably need to modify some things in that program to make them more sustainable. Tough to bring back employees when you don't have anything to bring them back to. But certainly we will continue to call for a vote in the state, or not the state Senate, the United States Senate. And we think that there probably will be one end of June or early August. And local governments need direct funding. State governments need help. Not just in New York now, it's across the country. So the reality is the only way we make up this gap without having to cut into the bone, and this is deep into the bone in our structure, is through federal government help at this point.
How many people from the Rye Day party have been tested for COVID, and if you know how many potentially tested positive?
Yeah, I don't know how many specifically have been tested. I know the day we opened up the testing site at the on-center lot on a holiday, we had 101 tests that day. So whether or not, tough to say how many of those came from the folks that were there, because we don't even know who was there and how many people were there. It's why these mass gatherings don't work. That's why the State Fair doesn't work. Unless you have some sort of registration system, these larger gatherings are very difficult. So that's the best information I can give you. And I don't know out of those 100 how many people have tested positive yet. My guess is midweek we'll know. And then through tracing, we'll be able to put folks back into that category. I'm certainly confident that some of the people being tested, that there was more than just 2, that there's going to be more people that get COVID from that party, whether that's household contacts or contacts with people who are positive, who are there after. Out of our 15 community spread, we already know 10 of them essentially knew they had contact with some level of COVID going in to get tested. The specific tracing back to the person hasn't been done yet. So out of those 10 people out of 15, you almost could put into the contact case category. We just don't know who yet. And again, the more we can stay on top of this, the more recoveries we have, when the active cases go down, when we get positives, we can really dive into the contact tracing and really try to hunker down to all of the causes and really take out the risk. But certainly, if we're going to see spikes, and we haven't seen them yet, but if we're going to see spikes, that makes that all harder.
Ryan, could you talk a little bit more about, you said 10 of the 15 knew they were somewhere where they got infected? What does that mean?
That means they got tested because they think they had exposure to COVID, and whether it's through job or through social gathering. Right now, we can't specifically trace them back to a person yet. once we can, or setting after the fact internally. We know that those weren't really community spread. They were a contact, but we will keep them in a community spread till we can put them in another category.
If you get it back to an individual, then you consider that a contact of some kind, not community spread.
Correct, an employer or an individual.
And you said that you're seeing more cases now among younger people.
Yes.
You have any numbers on that?
We can just share with you what we get each day, and we could do a 7-day average on new cases and certainly look at that and report that. But yeah, with the exception of today, I think today we saw a little bit more diversity in the age demographics. But when you look at 17 to 30, that has been a busy demographic with new COVID cases. I'm not suggesting lots of them, because I think our data is still on the right side of where it needs to be, but for a while there we saw a shift. In the beginning we saw young people getting this, and then we saw the shift once our facilities were invaded by this virus, and now we're kind of shifting back, and I believe it's social behavior. It's, these are demographics where these folks are more social. Especially, your 17, 18, 19-year-olds are very social. So we're seeing more cases, and we'll probably continue to see them. What's important is that the hospital infrastructure hasn't been stressed. Even though we had more today, we're in great shape there. And obviously the loss of life is something that we don't want to see at all. So if the trend is that your cases are going to be younger people because they're socializing, and you can box that in, and that doesn't spread to seniors or folks who have pre-existing conditions, then your hospital numbers don't really change, and you don't have a loss of life. But still, we can't afford spikes in any way when you're trying to restart your economy.
Well, from the trend line you laid out, where we were at 40-some cases a day, and now we're at 18. It sounds like the virus is diminishing in the community, and I know it's a hard number to come up with. Has anybody calculated the rate of transmission locally? Do we know if that's less than 1? Is it?
I don't have that number right now, Tim. We can look at that to try to figure out where that is. I think what we would have to do is take a macro testing number and look at where it's been over that period. To figure that out. We were looking 3-day averages, our nice 7-day averages are a little bit better, so we can try to get those numbers. Yep. No, I think we have to test these students, and then we have to have testing part of daily life with students and the universities until we have treatments and vaccines, and then you're still going to be testing. The virus isn't going anywhere. It's here. I will be the first person to be happy to be wrong, but I don't believe we're going to be in a sustained period where we have 0 cases. So it's here. How do we learn how to live with it? You build up your testing infrastructure, your tracing infrastructure, and then if you're going to welcome in people from outside the community, we test them, and we continually try to hit proactive testing numbers, so we're finding hidden pockets of the virus, and that's how we deal with it. That's how we live with it. So I think on opening, different schools are going to stage bringing students back at different times so that they can be tested, put into a quick quarantine until the results come back, and I think that's how we have to do it. And essentially, at first, you're going to have positives, right? You're going to have asymptomatic positives. You're going to have probably some symptomatic positives. Those folks are going to have to get put into their isolation. And then eventually you're going to have a situation where we're going to know everybody on the campus at SU and the campus at Lemoyne. We're going to know these folks don't have COVID. And then what's the risk for them getting COVID? The community. So that's why it's important that we make progress there. And then the challenge is once they go home, I think they schedule the Thanksgiving break and that's it until later on in the year. But when you bring them back, you're going to have to do the same thing over again until there's a vaccine and a treatment.
Jumping off that question, a lot of people may have anxiety about, a bunch of students coming in from potentially all over the country. So what would be your advice, or what would you say to people who are having anxiety about that? Where can they express that anxiety? Who should they reach out to with concerns about that?
Yeah, anyone who's having a hard time with this process certainly can call 211 for support. But I would say to those individuals, at first, the college students coming back into the community, we know who they are, and we know they're going to get a test when they come back in, and we know they're going to be quarantined. Then if they're positive, we know they're going to be isolated. That is actually a better and more structured and safer process than the randomness of the infection of COVID-19. As you can see, 15 people out of 460,000 isn't a lot. So the risk isn't that great, but you don't know where the risk is. So what do we do to prevent ourselves from risk? We wear a mask, we physically distance. Anytime, any place, you should be washing your hands, practicing good hygiene for you and your family. So, but from the standpoint of, the same thing with some of the things we talked about with different types of events with more than 50 people. How do you have them, who's on the invitation list for tracing, you get them tested, you can have the event over 50. That makes sense. Now, can you do that for an event of 150,000 a day like the fair? No, you can't. So that's a problem. So those are the realities, is if you know who's going to be at coming back into the campus, you know that they're tested, you then know who's COVID-free, they go to their dorm. These 20 or 50 kids are asymptomatic, but they got COVID, they're in an isolation. So more controlled process, actually. A lot of work, but more controlled process.
Have the colleges committed to making testing mandatory for their students?
I believe that the private colleges can, because it's private. So I believe part of both, we're talking to Lemoyne, and I know SU has a robust testing plan as kids come back. And then I would think they have plans related to periodic testing. I think the wastewater testing is going to be utilized as well in many of these dorms, so that you can pick up on that. Again, if you think you don't have any COVID cases in a dorm and all of a sudden you see it in the wastewater, you go in and you test everybody. And that's really, with the infrastructure where we are today, it's night and day from where we were in late February and early March.
When did you learn the fair was canceled, and what is your favorite fair memory?
I learned the fair was canceled when the rest of you did. And my favorite memory of the fair, certainly there's lots of memories. If you have too many wine slushies, Trish, it's tough to remember everything. You know that, I know. But I think when you look at the fair overall, I really enjoy the ag aspect of it. I enjoy the animals, especially the goat barn. So that's what I will miss the most this year. But we have lots of farms in the community, and hopefully this virus goes somewhere where some of the ag-related things on Farm Day and some of these other things, people will have the opportunity to still go. But there's a lot to be had at the fair. There's a lot of fun. There's a lot of eating. There's a lot of cervezas, as they say in some of the areas, in the wine slushy areas. And there's a lot of good commerce taking there, huge economic impact, huge blow to what people like to do with their social lives here locally, but also huge blow to our economy.
Ryan, we're heading into a hot week, to say the least. A lot of the things that people would do to escape the heat aren't available, or they're downsized in a way. We're not going to be able to pack beaches or escape to a movie, or even in some cases go to the mall. What is your concern for people as we reach these high temperatures and there is not much to do as far as escaping the heat?
Yeah, we're really, to your point, it's going to be very hot, and certainly it's going to be very humid. So we're going to encourage people to stay indoors. Hopefully you have some level of air conditioning in your homes that will help you deal with this. If there's infrastructure there to utilize to go to the beach, that's nice. I don't know what pools are. I don't think pools are open yet. Maybe the city pools, I don't know if they're going to be opening up soon enough. But really staying indoors, and again, trying to avoid some of these social settings, these larger gatherings, is really important as well. As we've seen in recent days, they lead to cases.
When you said that the increase in hospitalization is because of the heat and people being inside, is that what you said?
Certainly the heat and the humidity have an impact with our COVID patients who are having a hard time with this respiratory illness to begin with. So in this situation, what the doctors are being appropriately concerned about what's happening, and they're recommending people to go to the hospital, and the hospitals have capacity. So I think that's kind of what you see with the uptick with that, is that the respiratory virus is brutal to begin with, let alone if it's 90 degrees, 95 degrees and humid, and you got, a room air conditioning unit, not an air-conditioned home. These are all things that it's just tough. So instead of taking a chance, the hospital capacity is there. Use the hospital capacity to get us through this heat wave.
Over the last several days, new cases have been reported due to travel. Can you just kind of explain exactly what that means, and if you guys have any idea of maybe where people are coming from or going to?
Yeah, I haven't. We're watching it, right? It's a good question. If there's a trend right now, it's essentially travel back into the community from folks that live here. So, people travel and for work. They travel for vacation. Before, it's only been a week or so since there was these travel bans, or not travel bans, but travel quarantines in place. So I think we probably had 6 or 7 maybe so far related to travel, and that's something we're watching. Certainly if there's a narrative that these people are coming from one state or one event, if there's a group of people that all went someplace and then they came back and that group all had it, certainly we'll share that information. But so far, I've asked the health department to keep me alert if there is a narrative, and they've yet to give me a narrative.
You said some businesses have been warned that they're about to be fined, possibly?
Yeah, we've been building up our legal paper trail for some of these folks. This is, you're essentially have executive orders from the state level that are determining some of these, whether they're laws or they're orders. Lawyers will debate it, but certainly we have been putting people on notice, and we have fined people. But we think that some of these big box retailers are instructing their employees not to ask people to wear masks when they should be instructing them to wear masks. Situation that arises, somebody refuses. Certainly we don't want a greeter at Walmart getting into a physical altercation with a customer over that. But we have enough information that suggests that that people are being coached not to address the issue, and we think they should at least ask somebody to wear a mask and offer it. We'll give them the masks. So it's all gray, Tim. This thing has never been tested in court, and with these executive orders related to mask wearing. So we believe that people need to wear them, and if some of our big box retailers don't work with us on that, we'll go to the next level.
So you haven't fined anybody yet?
I know we find people. I don't know the list of people. I know that they continue getting an email saying, I went to Walmart, no one was wearing masks, or getting an email with pictures of everybody not wearing masks is different when it comes to what our options are for investigating things.
How many complaints did you get this weekend of either gatherings in people's backyards or bars and restaurants who aren't following?
Yeah, we got pictures sent to us from Skinny Atlas Lake. We got lots of complaints about masks. And so there's the anxiety in the community with this is there. And so people should respect that. It's not that hard to wear a mask, especially if you're going to go to the store. When you leave the store, you take it off. When you go home, you take it off. If you're not within 6 feet of people outside, take it off. These people need to be courteous because it works. It works.
Have you talked to the mall about their HVAC system?
Yeah, I think the mall is working with the state on ways to not worry about so much the product that gets you to cleaner air filtration, but how do you get to that a higher MERV rating, I think is what it's called. And so I think some of these products that have been discussed don't work with the mall, most malls' existing HVAC systems, but there's ways that they can upgrade their systems to get to the same goal of a higher MERV rating. So I think the mall's been doing that. Hopefully we'll get news on this. Again, we had 2 weeks. Phase 4 started. We've had 2 weeks. We went through the data. The data is better than it was going into phase 1. And we had 2 weeks of no action on some of these items. We need some action this week.
What did you guys talk about on your regional call? Did you have one today?
We did. Went over the data. Encouraged everybody to continue to keep the testing numbers up. We got to get them up a little bit this week. Again, same message. Good week to have some action. I think when people see action related to reopening and we're talking about it, they're reminded that we're still in this pandemic, and they're more focused in on the messaging that we give. I'm not up here every day anymore. The governor's not out there every day anymore just talking about this. So, going in, opening up malls, figuring out a way to get the gyms open, figuring out a way to get the movie theaters open, putting regulations in place where you can do it safely. This reminds people that we're reopening the economy, and at the same time reminds people we're still in a pandemic. So I think we need some action this week.
You were just talking about enforcing mask wearing in businesses and potentially, ticketing businesses that aren't enforcing it. But what specifically does it look like for enforcement for individual people, or are you guys mainly just focusing on businesses?
You can regulate businesses easier, and again, just play through a couple scenarios. You get how people are going to handle if you're at a gathering of 25 and one deputy comes up says, I'm going to give you all $25 tickets or whatever the tickets are. I don't even know if we don't even have a law to do that, right? I think it's just the governor's order. This is not a good scenario. So businesses, it's different. And so I get everybody likes to talk about enforcement. I get it. But the reality is these are not the legally tested processes, how many of these orders came, and also it's not feasible or rational for us to take somebody off, take law enforcement off of a call with a domestic disturbance or a call with a fire or emergency scenario or something else to go issue a couple tickets for mask wearing. It's just not feasible. That doesn't mean we don't enforce it. How we want to enforce it is with the businesses because it's easier to enforce things with businesses. That's why having the mall open is easier for us to go to Pyramid and say, you're not enforcing this, you're fined. That's a better outcome because they have the staff that will not let you into the building unless you have a mask, right? So it's easier to enforce the private sector. Now, enforcing social distancing gatherings, that's always been on the local police departments, and we've encouraged them last week, you need to do it more. There's data within our own community that shows when you have these gatherings, COVID can spread, so you got to do it more, and I think they get that.
Ryan, this question's a little bit off topic, but I just wonder if you have an opinion on the redistricting proposal that the legislature will consider tomorrow.
I support nonpartisan redistricting. I think the Democrats put up one plan. So I know there's a lot about this. The Republicans might put up their own plan. Nobody briefed me on it, which is probably not a good idea because I get to sign or veto it. So I don't understand what it does. But certainly I think there's a way to get to a product that could be good for the taxpayers overall. So I have not been briefed on the Democrat plan or the Republican plan, and certainly it'd probably be a good idea for me to get briefed at some point on it.
Do you think there is a Republican plan coming, though?
Yeah, I think, isn't there, I think they all signed a pledge saying they do reforms, right? I think there's a difference between the pledge they signed. They didn't sign a pledge saying they'd vote for the Democratic plan, and I think that's been reported that if you don't vote for the Democrat plan, that means you're not for redistricting. The Democratic caucus put up their plan. The Republican caucus, if they believe in it and they think there needs to be reforms, should put up their own plan. And then you take a vote, and if it needs my signature, people should brief it, because I can either veto it, I can sign it, or I can amend it.
Where are you watching Boeheim's Army?
4 o'clock tomorrow. I'm going to probably be working, but I'll be following closely on my droid. Anything else? We'll do this briefing on Thursday this week, so anybody watching, be back on Thursday. Let's continue to make progress. We really need to be smart with the weather. Be safe with the hot weather, but we all want to be outside. It's good to be outside. Let's utilize our park systems, our infrastructure we have here in our community. It's a great place to live, but we need to really respect this virus. And please wear a mask when you're going to be within 6 feet of each other, especially when you're socializing. We need to get these businesses off the schneid and get them open. And the only way we can do that is we got to make the case that it's safe to do that to the state. And so the data shows that we're there. We need to keep it going